Elected officials say the city is ready and urge calm.
Mayor de Blasio today riding the train to show New Yorkers the subways are safe. Here is what we know so far about the city's first Ebola case. Dr. Craig Spencer, who had been treating Ebola patients in West Africa, fell ill yesterday and is now in isolation. 3 others who had contact with Dr. Spencer, including his fiancée, are being monitored as well.
Investigators today retracing the doctor's steps during the time period while he was out in public and potentially contagious. We are waiting at this hour for a press conference at the Office of Emergency Management. Mayor de Blasio and other New York City health officials will give us a live update on this current situation of this first confirmed case of Ebola in the city. We're waiting on that. We have team coverage beginning with Janelle Burrell here live at Bellevue Hospital this noon. Janelle, take it away.
Well, Chris, during their last update, health officials said that Dr. Spencer has a good chance of making a full recovery because this was caught so early. Meanwhile, this afternoon, the staff here, they're making sure they're closely following protocol to ensure that this virus remains contained. Dr. Craig Spencer remains under close watch this afternoon in isolation at Bellevue Hospital, cared for by a staff specially trained to handle Ebola. Today, a team from the CDC and the state continue working to retrace the physician's steps.
Check in the last couple of days any person he possibly was in contact with. They've gone to the bowling alley, they've contacted the neighbors, they've isolated, they've closed off his apartment. It's not accessible to anyone. So the proper procedures are being implemented.
And we now know the doctor's condition when he was diagnosed Thursday was not as severe as first thought.
It's been reported that he had a 103 temperature. It wasn't 103. It was 100.3.
Spencer contracted the virus while helping treat Ebola patients in Guinea, West Africa, with the nonprofit Doctors Without Borders. Last Friday, he flew back to JFK Airport and cleared the CDC enhanced screening with no symptoms, and health officials say continued monitoring his own temperature twice daily. We're told he started feeling fatigued on Tuesday, took the subway to meet up with friends in Brooklyn on Wednesday, and by Thursday morning, he had a fever, experiencing gastrointestinal distress.
When he reported fever, he contacted the health department. We contacted EMS.
A fully suited team rushed him to Bellevue, where this afternoon most at the hospital are confident the virus will remain contained.
My son goes here to daycare, and they're fully equipped, so I have no worries whatsoever.
City and state leaders insist the public is not at risk.
Everything that happened here, by the way, was a textbook case of how the situation should be handled.
And Mayor de Blasio was on the subway earlier this morning, showing that the public really has nothing to be concerned about. Still, though, the CDC attempting to reach out to all of the people that Dr. Spencer may have come in contact with. We're live this afternoon outside of Bellevue Hospital. Janelle Burrell, CBS 2 News.